I'm now going to show you how to do a patellar tap test, which is a test for too much synovial fluid in the knee, which is known as an effusion. The synovial membrane in the knee joint extends about 3 or 4 finger breadths above the superior aspect of the patella. So what we need to do is put our hand here, squeeze down any excess fluid, keep it squeezed down, make a tripod with our fingers, and we're bouncing the patella on the femoral condyles. If we can sense or hear a click, it means that there's too much synovial fluid in the knee. I'm going to show you a PA and an AP draw test at the knee for the anterior and the posterior cruciate ligament. So I have the patient with the knee flexed to 90 degrees. I place my hands behind the calf and I rock back, and I'm causing a distractive force, an anterior shear force to the tibia. If he's ruptured his anterior cruciate, there'll be too much movement of the tibia forwards. For a posterior draw or an AP draw, I do the opposite. I put my thenar eminence on his tibia and I push. And if there's too much laxity in the PCL, his tibia will fall too far back. One of the problems with a PA draw at the knee is that if he is in pain and I try to pull his tibia forwards, he's going to use his hamstrings to try and stop me. So there's another test called Lachman's test, which is similar, but it's thought to be more sensitive. And I do the test with his knee in about 30 degrees of flexion. And what I'm going to do is hold onto his femur, hold onto his tibia, and apply a positive forward movement like this on the tibia. And he can't use his hamstrings in the same way to compensate. And a positive result will be excessive anterior translation of the tibia. If we suspect that our patient has a ruptured Achilles tendon, we'll do a Thompson test. All we do for a Thompson test is lie the patient on their front with their feet hanging over the edge of the bed, and we literally squeeze the calf. If the Achilles tendon is intact, the foot will plantarflex. If the Achilles tendon is ruptured, there will be no movement of the foot when we passively squeeze the gastroc. I'm just going to very quickly show you how to do a Varus and a valgus stress test at the knee. So the valgus stress test is a test for problems with the medial collateral ligament of the knee. And what we do with the patient in lying is to flex the knee to about 30 degrees. What I like to do is to put my knee on the bed and make a sandwich so that his femur will then not move. And all I'm doing then is applying a gentle gapping pressure to the outside of his tibia. Reproduction of his pain will be positive, and if he's ruptured the ligament, there will be laxity. Now, to do the opposite test, all I do, I move this hand around 180 degrees, I move this hand 180 degrees, and I turn around. And I can now do a Varus stress test for the lateral collateral ligament, again with the knee in about 30 degrees of flexion. So that's a Varus and a valgus stress test for the medial and lateral collateral ligaments. Okay, my name is Dr. Stuart Porter, and I'm the admissions officer for the full-time physiotherapy program here at the University of Salford. We have 4 international students with me, all from Hong Kong, who are going to tell you a little bit about why they chose to come to Salford.
Hey, I'm Rick, so I'm from Hong Kong, and the reason that I came to Salford is because I love Man United and it's in Manchester, and Salford is in Manchester. That's one of the reasons. And the other reason could be like, the lecturers, they're so good, they're so supportive to me. And yeah, their knowledge base is so good, and I feel like the best lecturers in the world. So that is the reason that I came to Salford, and I'm so happy that I've made these decisions like that, and yeah, I'm just so happy about it.
Hi, my name is Alison and I'm from Hong Kong as well. The reason why I chose Salford is because all the staff and lecturers here are so supportive, and I really learned a lot from them, and the whole layout throughout the 3-year course is really good. Yeah, that's the reason why I chose Salford.
Right, my name is Samantha and I'm also from Hong Kong. The reason why I chose Salford here is because the staff are very supportive and nice. They provide lots of learning opportunities, including varieties of placement and also different lessons layouts, and also the module here is very nice, and I feel I learned a lot in here.
Hi, my name is Henry. So why I choose Salford is because like this course is really structured. Like they get used to like doing these things like around years, and the lecturers are so supportive. And I think the Hong Kong Health Association, like in the hospital things, they just send staff here to like do forward study and something like that. So I would say we suggest you to come Salford.